Murkowski.
Thank you, Mr. Chairman. It's nice to see you up on the dais here this morning. And welcome, Governor. Appreciate your willingness to step into this position. Incredibly important, as all have mentioned. I want to talk a little bit about access this morning. You and I had an opportunity to chat about it when you visited with me. I had a conference call last week, brought in about a dozen primary care doctors, some mid-level providers, and was asking them about the issue of access for Medicare beneficiaries. And I basically said, give me a couple legislative fixes that they would suggest. And almost unanimously, what these providers said that they had been hearing from their Medicare patients, that they simply wished that they could opt out of Medicare and into private insurance. After that conference call, I was on a teletown meeting, had about 4,000 Alaskans that were speaking to the issue of access to Medicare, and heard the same refrain, which I find absolutely stunning. You pay into the system your whole working life, and they're now at the point as retirees where they're saying, I'm prepared to reject a program, forego the benefits, just so that I can have access to a medical care provider. In Anchorage, our largest state, we've got a situation where we just have providers that are no longer accepting Medicare eligible individuals. 1 in 10 is taking any new Medicare eligible patients. So we've got a situation where we're talking about all the great things that we're going to be doing here in the Congress and healthcare reform, but I don't have providers that are willing to take any new or existing Medicare eligible individuals. This is a huge issue for us, and it's not just in Alaska, it's not just in rural America. When Senator Daschle was doing his healthcare tour, he heard the same things when he was out in Dublin, Indiana last December. The MedPAC, the Medicare Payment Advisory Committee, estimates that 17% of all seniors nationwide had significant problems accessing primary care healthcare services. So I guess my question to you this morning is we clearly have very serious problems when it comes to the reimbursement issues that we have discussed, access, making sure that you have providers that will accept those that are Medicare eligible. How do we strengthen this Medicare program so that you have, so that when you have that Medicare card, that it means that you have access to care? Because right now, in the largest city in my state, having that Medicare card means nothing if they can't get into a provider, and right now they can't. So what do we do?
Well, Senator, I appreciate your concern, and it is a huge concern, and one that I share. Clearly, having a card does you little good if you can't see a doctor and can't get the care that has been promised to you by that card. So the issues of access in your state, in parts of rural America, in areas of the country where access is a problem need to be addressed. And I can assure you, if confirmed, I would love to work with you on that. It's my understanding that in Alaska there has been a fairly recent payment adjustment. And I'm hopeful that you may see some relief in the access issue based on that, but I think addressing as we move forward, what are the various reasons that providers are not opting to take Medicare patients? If it isn't a payment situation, what are the other additional factors is something that I just can commit that I would be eager to work with you to try and resolve.
So much of it is the payment side. It's the reimbursement side, and we hear that time and time again. And yes, you are correct. We were able to get an increase in reimbursement effective the first of the year. What we're seeing, interestingly enough, is physicians are not taking on new Medicare eligible individuals. What they're doing is, as their existing patients are aging into Medicare, they are choosing to keep them on. What we were seeing last year was folks who had gone to the same provider for 10, 15 years. They're fine as long as they don't hit that magic age of 65, but when that birthday rolls around, their doctor tells them, I'm sorry, I'm not able to see you. We think that we may have stemmed that in fact they are willing to keep their existing patients on, but we're not able to add anyone new, which is a very, very serious problem. And unfortunately, we're not seeing it really get better, so we need to be working with you on this. We need to be addressing the increased healthcare costs that we face in a very rural state like Alaska, and addressing reimbursement that is a reasonable reimbursement rate. I would extend the offer to you to come up and see some of the challenges that we face, as well as some of the remarkable achievements that we have made in delivering health care through telemedicine and just being smart with what we do with the dollars. But we do need some help, and we will look forward to the opportunity to be working with you.
Thank you.
Just a point here. I want to say about Senator Murkowski, it isn't just the states like Alaska. The problem is all over the country. And we have about 8 to 10 individual openings for qualified people for nursing and for other professionals in this area. And there is a critical national need. And I'm glad you mentioned this. It's incredibly important, and to Alaska and to other states. Thank you for bringing this up. Senator Song? Senator Reed, excuse me.